I see you.
What do I do here? Allow. Okay.
Ah, I'm gonna have to mute you on here. Phew.
Am I good to go now?
Mm-hmm.
Are people there? I can't see anyone. Oh, raised hands. 9 people have raised hands.
I'm gonna turn on. The chat is on. So
Okay.
click on the chat window.
All right. Hello, everyone. Sorry for the bit of a late start. We were actually ready to go, but our computers decided they wanted to take a few minutes to get going. So welcome, everyone. Thank you for agreeing to spend your lunchtime with me today to talk about the Affordable Care Act and what's happening in DC with the replacement effort there. I have a presentation to show you that'll give you some background that's really important to know about the actors who are involved and about their drives and what they want to see out of the program. So without further delay, we'll get started on that. Larry, I don't see a share screen on here.
Over here. Right there.
All right, there we go.
And then application window. Oh, nope. Close that. No. Go there. Application window. And select that. And hit share. Close that. And go to your window. That's not sharing.
One moment, please.
Application window. It disappeared. Okay, here. Click. I don't know why you do it.
Let's just share the whole window then.
Nope, there it is.
Okay.
Click and hit share.
All right, I think we got it now.
There we go. And then you should be able to.
Let's get started. Seeing me now?
Mm-hmm.
All right, so our presentation today is the future of the Affordable Care Act. And for drama, we have some clouds. It's feeling like Seattle around here. We have rain about every other day. So I'm Sherry Daly. I am the Senior Governmental Affairs Director for the California Consortium of Addiction Programs and Professionals. I've been doing this for over 20 years. I did want to let you all know that CCAP is the only California organization that actually employs a full-time lobbyist in Washington, D.C. His name is Andrew Kessler with Slingshot Solutions. So just wanted you all to be aware of that, because when you go to pay your membership dues, sometimes we have members who ask, what does that pay for? And you'll notice on your membership dues that there's a little notice that part of your membership pays for our lobbying efforts, both in California and in Washington, D.C. Okay, so today we're going to talk about the future of the Affordable Care Act, or not the Affordable Care Act. And there are 4 main areas that we're going to focus on. The inputs, that is, who is shaping the president's perspectives, who has his ear, who's talking to him on a daily basis about healthcare. And then we need to know a little bit about the process. How will the legislation develop? We hear a lot in the news that one thing is happening, or there's an attempt to do this with the legislation, and it's kind of confusing. So we'll go over the process a little bit so you'll be aware of how and when things take place in Washington, D.C. And then we'll talk a little bit about your impact, how you can impact this whole process by accessing your local congressman and being active in your districts. And then finally, we'll go over a little bit about what a long-term approach for funding addiction care in California and the nation might look like. So those are the 4 areas that we'll cover today. And we'll leave plenty of time for questions, and I've got Larry here in the room, so if you have a question along the way, he can see what you're asking and bring some attention to it. So we can have this as interactive as you would like. Okay, so let's start with, it's not moving there. Oh, I gotta go up here, never mind. Okay, so what are the input factors? Who is impacting what the president might do? So he has his trusted advisors. This is a group of people that he listens to or doesn't listen to, as the case may be, that are well-versed in healthcare policy and have different views of how it might go. He also has his party that helped to elect him that has definite views about how the strategy should go and what should be in or out of healthcare. And then there's an economic reality. What can he do? What can't he do? Some of the statements being made may or may not be able to actually be fulfilled given the economic realities that there are out there. And then finally, there's public outcry. How will the public react to anything that is done in the healthcare area, which has, since I put this presentation together back in January, public outcry has taken a major role in how this policy is developing. So let's look at his trusted advisors, and there are several of them. First of all, there's the Vice President, Mike Pence. And then there's the Speaker of the House, Paul Ryan. The 2 of them were also congressmen together and kind of traveled around in the same circles. So they have similar views with some important differences. And then we have Reince Priebus, who is the chief of staff now. He was the chair of the Republican National Committee that put together the election. And then what we have, I like to call is Jarvanka. That's Ivanka and Jared Kushner, who is the daughter of the president and his son-in-law. And they have a lot to say about what happens in the White House, believe it or not. And that's developing as we go. The main person who is driving what happens with health Okay. Hello.
Just a second. There you go.
Sorry about that. My computer is apparently fighting with me today, so I will go back to the slideshow. And we'll pick up where we left off, talking about the Speaker of the House's views. Okay, can you see that, or am I not on yet?
It's not shared.
Sorry, it's not showing the application window again.
Can you leave that up? leave that up,
Okay.
then click over here.
Ah, there we go. Stopped fighting. We're back. Okay, so Paul Ryan, the Speaker of the House, before he became more pivotal in this situation, had his own view of healthcare, which was called a better way to fix healthcare. And some of the ideas are very popular and have kind of been adopted as everyone's choice. For instance, they want to keep dependent care for people to age 26, which is pretty much universally agreed upon. He wants to have refundable tax credits, protection for people for pre-existing conditions. Those are all things that we forget didn't exist before the Affordable Care Act actually was implemented. So those things, it looks like, are going to stay with us forever. Some things that he wants to change, though, are to institute high-risk pools. That is, if you have a pre-existing condition, you might not be insured with the rest of the group insurance out there. You would have a special plan where you would go. These in the past have been criticized for having caps on the amount of care you could get through them and long wait lists to see physicians and get care. So the promise is that they would look at high-risk pools again, taking people with expensive pre-existing conditions and improving the way they get their health care so as to avoid those types of complications. Of course, all of the Republican plans are big on the idea of having a health savings account. So you would put some of your own money away, maybe you'd get a bit of a stipend from the US government to put in your account, and then you would be able to spend that account how you see fit. And the whole idea behind this is so that people would make wiser decisions, more economically sound decisions about healthcare, and that would bring down the cost of healthcare overall. There is also some talk about financing part of the Affordable Care Act, this is under the Republican plans, by reducing the benefit you get tax-wise. So if you work for a major corporation or you work for a city, county, or federal government or state government, you get a health care plan, and that's part of your compensation package, and you are not currently taxed on receiving that plan. So some of the Republican plans want to end that exclusion, that you don't count that as income, and actually raise some of the funding to pay for the plan through actually taxing some of those, they call them Cadillac plans. The Republicans also heavily base their plans in the ability to opt out or not pay for health insurance, not be part of the plan. And some talk has been had about making the Medicaid expansion group, in our state that would be Medi-Cal. That group is the below 150% of poverty, people who typically are not putting any money into the healthcare system, turning that into a block grant type of situation. And we'll go over what that might do to our system if that were to happen. Okay, the next person that's important to this is Reince Priebus. He, of course, is the chief of staff. He kind of echoes what the vice president's rules are. Another important element that they all include in the Republican plans is selling health care across state lines. Again, this is meant to bring competition to the arena of healthcare purchasing and therefore bring down the cost. There hasn't been a whole lot of data to show that it works because healthcare insurers depend on networks. So a healthcare insurer is contracting with several doctors, clinics, hospitals, in our cases, our treatment programs. And they know them well because their staff is on the ground in California, working with people, visiting them, dealing with complaints. So it's the idea that you could have somebody in Nebraska setting up network plans in California may or may not hold water. Also, you know, you might ask yourself, why are they doing this? Why is that an important thing? It's also the insurance lobby making it's raising its head here, because if they're allowed to sell insurance interstate, they will pick the state with the least regulation on insurers. So if I'm an insurer and I want to avoid California's, let's say California makes sure that people have access to mental health and substance use disorder services. They have different network adequacy requirements in California than they do in Nebraska. As a healthcare insurer, I'm going to pick the state with the least amount of regulation, the least amount of ability to change the way I do business and make profit. So the sell across state lines, although sounds like it's a an idea that might lower costs. It also has an ability to lower regulation of insurance and perhaps how people access care. Another item that Republicans like to present is that small businesses and individuals might be able to pool their resources together and become a group and apply for group coverage. So that's also an idea they put forward. Priebus also likes the idea of limiting the types of lawsuits that can be made to lower costs of insurance. That was one of the ideas that he had that didn't really come through in the plan that was presented by the White House here in January. So the same sorts of things, tax breaks, pre-existing conditions, he's pretty much on board with all of those ideas. The next gentleman that we want to pay particular attention to is the Vice President, Mike Pence. Now, he has kind of a deeper understanding of healthcare because he was a governor, and he's governor of a state, that Indiana, that actually implemented the Affordable Care Act, so he's a little more familiar with it. Indiana was one of the last states to come online with the Medicaid expansion group, but their state did, so he's familiar with that as well. So he has kind of a technical level that some don't. So it's important to kind of look at what happened in Indiana, because he believes, and this was said through some of the confirmation hearings for the health director, and also through some of the early press announcements about the replacement plan, he's kind of driving some of this. So in Indiana, they have something called a power account. So your power account is something that you are automatically given once you enroll in Healthy Indiana. So what it does is it gives you a set amount of cash, basically, that you can spend only on healthcare items, which sounds like something that might be a good idea because it's consumer driven. So you might decide that if Dr. A is going to do a health screening for your child, let's say you're getting immunizations for a baby, and is charging less than the doctor down the street, you may pick the one that's offering a lower price. Not sure if that actually plays out in practice, because you might like Dr. A and be willing to pay $5 more because you like that doctor. Important to know about our population for substance use disorder and mental health patients, they have to be aware, first off, that they have an account. In Indiana, they showed that nearly 60% of enrollees did not even know they had the account of which they used to buy health care. So we all know when the Affordable Care Act rolled out in California, it was very difficult to navigate people through it, particularly some of our clients. It's difficult to get them to understand how to access care, and it was a pretty simplified solution. This one is more complex. You have to know you have an account. And then there's a stipulation that if you are between, I think it's 100 and 400% of poverty, you have to put in a set amount into this account each month. And if you do not, you lose coverage. They penalize you for like a 6-month period in Indiana if you don't make your power account payment. So there are some definite issues for people who are experiencing mental health or SUD claims. And not exactly the best sort of plan for them, people in crisis, to understand how to access, not only to enroll in healthcare, but to locate a plan online and an account, and know what the rules are and what happens if you don't follow them. So that's where Pence is coming from. So it's important to understand what he sees as the future for healthcare. The good news, though, is that in Indiana, the SUD benefit was included as one of the 10 essential benefits, and they are actively working on expanding their coverage for residential detox, housing, and recovery. So the state itself does have a more progressive than some states attitude about substance use disorder. So that's something in our favor as far as the way Pence has an outlook on healthcare. But definitely he sees a lot of accountability issues with healthcare. There's even some talk of requiring able-bodied people to produce proof of work or searching for work, much in the same way that other benefits are provided in California, for instance. So that would be new as well. So that's where Pence is coming from. He's a very conservative Republican. He voted no on regulating tobacco as a drug, voted no on the CHIP, that's the Children's Health Insurance Program. and no on parity. So that's who we're dealing with as a vice president, and with having a lot of influence and more of a technocrat in the area of healthcare. And that's where he's coming from. So we need to be sure we're aware that he is not particularly friendly to issues that we would support in some cases. The next gentleman that helps shape policy at the federal level is Dr. Tom Price. He is the Director of Health and Human the Secretary of Health and Human Services, and a former congressman. And he has a little bit of a different take on it. He favors the high-risk pool idea, of course, accepts all of the other keeping coverage till you're 26, no exclusions for pre-existing conditions. Where he's influencing the policy that is running into some trouble for the White House is that he wants to change the tax credits based on age and the stipends based on age. So basically, if you're older and older people tend to be sicker, you would have to pay more in, and young people would receive the benefit of paying less. That motivated an opposed position from ARP, which is a huge lobbying force at the Capitol. So it's a kind of situation where if you change the benefit to help one end of the system and make up for it in another end of the system, then you end up alienating a different group of constituents. So of course he supports the insurance across state lines idea and the health savings accounts, and letting people opt out. He also is heavily for repealing the Medicaid expansion as a means of cost savings. So that's where he's coming from. Next, we have Jarvanka, which is Ivanka Trump and Jared Kushner. And these two are kind of wild cards, both former Democrats, both pretty liberal in their outlooks. Ivanka, of course, is probably President Trump's #1 advisor, and that she has that personal connection with him and he trusts what she believes. She has 3 young children. She has tended to take up women's issues and seems to have a more empathetic ear toward healthcare. And an interesting thing to know about this couple is that Jared Kushner's brother, Joshua Kushner, is also the owner of Oscar Health, which is an insurance company that works with the Affordable Care Act. In fact, it's a $2.7 billion insurance company that he runs, which would be dramatically impacted if the Affordable Care Act were to go away. So there is a person within the president's midst who not only understands healthcare, but actually runs it as a business. And he happens to be very close to the very closest people in President Trump's environment now. So that's an important kind of wild card to keep in mind as we watch this unfold. So if you would like to find a place to actually look at alternatives as they come up, the Kaiser Family Foundation and this presentation will be set up so you can access it later. But this website is fantastic. So what it does is you can pick any of the alternatives that should come up, and the American Health Care Act is one of them. Rand Paul had one, Senator Cassidy had one, and they have tabs for them. You can pull them up, and they've nicely laid out so you don't have to dig through hundreds of pages of legislation. You can do a side-by-side comparison between the Affordable Care Act, how it is now, and what the pending legislation would do to it. And it's a fantastic resource. If you hear anything in the news about a new plan being proposed, go there. They get it up almost instantly, and it's a great tool. So what should you be concerning yourself with when you hear things happening in the news? Let's pay a little bit of attention, because there's a lot said about healthcare. There was a lot said during January, February, and currently. So what are the key things that you as a SUD or mental health practitioner might want to tune your ears toward? So what you want to watch for is the words block granting. So block granting, although it sounds wonderful that we will give each of the states what they would have gotten for the Medicaid expansion, we'll just give them that amount of money and let the states do whatever they want with. Well, there are 2 problems that might arise if that were to happen. The block granting almost always comes with a cap. So they would set it at 2017 levels, and then they would freeze it at that level at some point, let's say 2020, they would freeze it at that level. And we all know that inflation affects future costs of things, particularly in healthcare. Healthcare is the prices for items in the healthcare market are rising more than the actual inflation of other things. So it's a way of actually reducing the amount the federal government spends and containing that within states, which would mean cuts if the states weren't able to make up for it. The other thing it does is it usually comes with the next term that you want to watch out for is any discussion about ridding ourselves of the essential benefits. Of course, SUD and mental health are two of the 10 essential benefits in the essential benefits. And when they talk about block granting, they normally tie that together with removing the requirement for essential benefits. So in other words, the states would be given a pot of money and they could decide what they want to spend it on. Those of you who, like me, have worked with legislatures and understand our ability to affect change as opposed to larger, more influential groups, and the stigma that goes along with mental health and substance use disorder, we typically don't fare that well when we have to go up in competition against other competing benefits. So that would be something that would be a negative for us. So watch for block granting essential benefits, and then watch for any discussion about accountability. That's a word that they use to intermingle to mean skin in the game. And that would be requirements that make it difficult to get insurance. That would be work requirements, payment requirements, anything that would require our clients to make it more difficult to get coverage. And then watch for any changes to parity, because believe it or not, there's attempts to roll back parity as well. So those are basically the items that you want to listen for in the news. And if you hear of them, you want to go into action. We'll talk about some ways that you can do that here shortly. Okay, so a lot of questions about how is this going to happen? Now in January, there was almost a degree of panic about what can the president and Congress do, when will it happen, how will it affect my clients. So I want to spend just a little bit of time about how the changes can happen. It was particularly pertinent because we still have some ongoing attempts to change the Affordable Care Act. So we have executive orders. When the president was sworn into office, he went into signing executive orders. You see him holding them up with his big signature on them. And then you have the next level, which is regulatory change. So he is in charge of the administration. So he's in charge of all of the administrators who carry out regulation throughout the country. So he can change those regulations through the regulatory process. Then we have something called budget reconciliation. And budget reconciliation is what we heard in January, and that's how the changes for the American Health Care Act were put together. And then finally, we have law. So what would Trumpcare look like? And I'm just going to spend a little bit of time on each of these four so that when you hear it, you'll know, is that coming now? Is that coming next week? Is that coming in a year from now? How do these different things affect the timing of any changes to healthcare and for other laws for that matter? So the president signed an executive order. So basically what he did was said that he would begin writing new regulation. He would expand the scope of some demonstration projects, and he would delay changes in regulatory provisions, those that were in progress basically. And he would change the requirements for rate setting and essential benefits. So unfortunately, and I don't know if any of you remember this, but when the Affordable Care Act first passed, we spent a lot of time waiting for for Medicaid to say, what is an essential benefit? Essential benefits were vaguely described by the Affordable Care Act, but it was really regulatory process that decided what they were, what were the rules, what are the hardship ways to get out of participating in the program. A lot of regulation followed up on what was truly a monumental piece of legislation. So regulation then is in the hands of whoever is in charge of the administration. So all of those rules that make up the Affordable Care Act can be changed through regulation. Now, these have to go through notice and a public hearing, and they can't change the statute itself. So regulation is limited, And these executive orders are limited in that they can't change funding and they can't change the statute. So when you saw that executive order go through, it was very limited, but it just kind of set the scene for what the president wanted to do, which was lessen the ability of the program to require certain elements from those providing the insurance and those paying for it. Did I drop out again, Larry, or am I still? Okay, so then there's regulatory change, and this is the actual changing those regulations. So that can't be done with the signature on a piece of paper. That has to go through an actual regulatory process that can take a year to 18 months, depending on how complex and what the regulatory calendar looks like. So they can make changes at the administration level through regulation to make it more difficult to enroll. They can change the enrollment periods. They can change what types of rules there are. They can change some of the contraceptive mandates, any of the rules that are in place now can be changed through the regulatory process. But regulation cannot change the statute, and it cannot change the funding for the Affordable Care Act. So those two things the administration can do and will probably make some changes to.
Glenn has a question.
Okay.
Do we have a timeline as to when Trumpcare begins?
Okay, we'll get there next, Glenn. Just hold on just a second. So then there's what we call budget reconciliation. So budget reconciliation is an actual piece of it's a bill. It creates statute, but it was meant to be just so you can align things with the budget. So in other words, if the budget is out of whack for whatever reason, Congress can act with only a 50% vote in Congress to repeal certain things. They can't create things, but they can get rid of things. So they can basically defund the Affordable Care Act if they choose to do so. And that was what process they were using here in January. So specifically, it would end some federal subsidies for purchasing the insurance. It could end the Medicaid expansion. There are lots of things that a Budget Reconciliation Act, which is filibuster proof in the Senate. It can't be overridden by the Senate. So they can basically unfund whatever piece of the Affordable Care Act that they want to. They did not, but that was the process that they were using. So the final product then, and you probably heard a lot if you're watching the news about this three-pronged approach. So it was unfair because we only got to see the first prong, and that wasn't something that the administration made up. It's actually real. The approach was to change some of the funding, get rid of some of the plan, and then to create new things that would have to be done with legislation. So legislation actually requires a 60% vote to make it filibuster proof in the Senate. So that takes working with everyone, and that did not happen. So if that were to happen, that would be something that would require some negotiation and a widening of the circle. So the timing on the act. So the American Health Care Act was put forward and was not passed by Congress. It was not even voted upon because the votes weren't there. How that happened, we'll talk about in just a moment, but I want to let you know what was in the act that they were preparing to move forward. So basically, they were taking Price's plan to increase the amount of, or decrease the amount that younger people had to pay into the system and increase it for older adults. And that angered the retirement community and the AR people and caused a lot of problems for it. And they wanted to phase out the tax credits at the higher income levels. So that was one part of it. They also wanted to maintain the pre-existing conditions and the coverage to 26, so that was great. But they added the ability for the states to define the essential health benefits, which of course was not viewed favorably by a lot of your moderate Republicans because they knew that spelled an end to what people are enjoying now as coverage. And then they also followed the drive to go to a block grant system, which also would reduce the amount of health care out there. And at a certain point, limiting your high risk, which would include SUD and mental health disorders, by capping it at $115 billion in 9 years, and that's for the entire nation. So the plan was It also imposed a late penalty for people who don't stay continuously covered, so there were some punitive issues with it. So it was not real palatable to moderate Republicans, but given that it was the president's first major piece of legislation out the gate, a lot of them were willing to support it. But the Freedom Caucus was not happy at all because it felt as though the change in the act didn't go far enough as far as removing the federal government's involvement in the Healthcare Act. So it actually didn't go anywhere. There is not a plan to change the Affordable Care Act at this time. There was a push right before they went to the spring recess here to cobble together a new plan that might make the more conservative people in the Freedom Caucus like the plan more, but every time they add something that's more conservative as far as kicking more people off of healthcare, then they lose moderate votes. So they tried to cobble this together right before spring recess and then sent everybody back to their districts. And back in their districts, people are holding town halls, everyone's coming out. So basically what's happening right now is that the Republicans have 247 seats and there are 188 Democrats, which you'd be saying to yourself, well, sure, they can pass anything. They've got a big majority. But the problem is that if 36 or more of the Republicans refuse to vote on any one item, then it fails. They don't have their majority anymore. And right now there are some 40 members of the Freedom Caucus who will not vote for what was put forward by the vice president and the secretary and the president. So for now, it is dead on arrival, not being revived at the moment, and the president has said he's moving on. So what does that mean for us? Well, the Freedom Caucus wants all of the essential health benefits removed, and the ability to allow insurers to change the rating. So in other words, if you're sicker, you're older, you live in an area of town that might be more dangerous to live in, they could charge you more for insurance. And that goes against the basic principle of the Affordable Care Act, which is that everyone comes into the pool, the different risk areas that everyone has makes it even out, so everybody pays the same amount, everybody gets the same benefit, and nobody's penalized for their state of health or where they live. The Freedom Caucus wants those two things to happen, and the moderate Republicans will not let those things happen, so we're kind of at a standoff for the foreseeable future. So how can you impact this process? Your voice really does matter. Public outcry in January and February, marches, town hall meetings, etc., were all very effective in impacting both keeping the Democrats from letting it pass and also keeping the moderate Republicans on board. So what you want to do is you want to use the press, make sure that you know your local editorial people, whoever writes for your newspaper, invite them to come to your program. Give them a tour, talk about recovery, talk about treatment, talk about what a great job your place of employment or your program offers the community. Advocate when you can at town hall meetings. Go and talk about what would happen if the essential benefits went away. And make yourself an expert to your congressional staff. Go in and introduce yourself to your congressman's staff. You don't need to meet the actual congressman or woman yourself. You can meet their staff, become their expert, because a lot of them don't know about substance use disorder. And if they have your number and your card and they can call you, you become their expert when something comes up. So make sure you do that. Make sure you ask hard questions. Don't come at it as an approach of begging that our clients receive care. Go at it more as, of course they do. Why would we think any other way? So moving forward, the ability to fund treatment for addiction and mental health services is always going to be an issue. We are going to start looking at this from an approach of what CCAP has introduced, which is the California Comprehensive Addiction Recovery Act. And you can go to ccara.info and look at what that entails. But basically, it's a comprehensive package to expand capacity, expand workforce, professionalize the workforce, and reduce some of the things that drag on our system, like some of the fraud and abuse in the payment arrangements between insurers and companies. So if we can all come together and support a comprehensive approach to funding and to working out, making our system better, we can all move forward together. So I encourage you to look at the ccara.info. So we have some time for some questions. I hope I answered Glenn's question about timing. Right now, they're all on spring recess, and the plan that was put forward has failed. There would have to be some coming together of either the more moderate Republicans working with Democrats, and the Democrats have vowed not to work on changing or repealing the Affordable Care Act, or there would have to be some sort of seismic shift in the Republican Party to support what the most conservative wing of their party is pushing, which is the elimination of the essential benefits and a lot of payment reform and privatizing basically the insurance market and letting the insurers decide what qualities and quantities of insurance are sold. So it's not looking like it's moving forward anytime soon. Stay in touch with, I know that we send out a lot of messaging about it, a lot of different things, but stay in touch with our alert systems, because we will let you know if anything's happening. And we do have Andrew Kessler in Washington, D.C., who is there at the Capitol most days and has an office downtown. So he's very much in tune with what's going on, particularly with our issues with regard to healthcare. So we have about 10 minutes left. I'm going to switch back over and say hello to you again. There I am, I think. Okay, so does anybody have any more questions? I'm looking. So I see we had maybe some problems with the transmission of the program today. We're working on those. We just got our new web platform this year, so I think it's going well. Does anybody else have any other questions about the Affordable Care Act or about lobbying their local congressman? I'm here to answer them. And if anybody would like to contact our lobbyists in Washington, D.C., maybe you're going to Washington, D.C. on, let's say, a field trip for one of your kids, or you're just visiting as a tourist, Andrew Kessler would be happy to help make some arrangements. So maybe if your congressman or woman is in, or your senator is in, he could help to assist with a visit or an introduction to their staff if they're not available or not in. So you can email us here at CCAP and we'll get you in touch with Andrew. So everyone always seems to ask questions at the end. I'm watching for questions, so I'm just talking as we go here. Everyone wants to know at the end of the program, how do I get my CEs? So this is an accepted CE for our certification processes for renewal. And you will be sent, after this webinar, you'll be sent an invitation to go to a SurveyMonkey site and answer the post questions, 3 brief questions about today's presentation to show you were tuned in and listening. And once you answer those 3 questions, you will be sent a proof of completion of these CEs and be able to save that for your renewal period.
Alicia wants to know the link for the comparison of the different proposals. I think she means CCAR, maybe.
Okay, so I'd have to go back on there. Let me pull that back up and I'll give you, it's Kaiser Family Foundation is the website. And let me flip through really quickly and get you on those. So I'm not sure how we're going to do that. Maybe Larry can pull up the...
I think she means CCAR.
Oh, ccara.info. CCARA.info is CCAP's comprehensive approach to changing the treatment system here in California. If you're looking for that, if you would like a link to the comparison of the different forms of healthcare plans that come out, Larry, could you find that? It's on page 17 of the slide. I don't know.
I don't have the slide.
Oh, let me copy it. Can I post here?
Mm-hmm.
Okay, let me put it on there. Do I just hold on one moment? I'll put it in there. I don't know how I get to talk. How do I talk, Blair?
You want to?
I just want to post it here. Yeah, I want to type just to, oh, right there.
Yeah.
Never mind, I can see it. Okay, there you go. That would be the link to go and look, and that is just a terrific website. Anything new that comes up that they introduce, Kaiser Family Foundation will split it out into the pertinent points. It gives like an overview at the top between the Affordable Care Act and whatever plan you're looking at. And then if you want to drill down further, it will actually tell you things depending on what issue you're looking at, like co-payments, caps, existing conditions. It kind of breaks them all out in the different areas so you can have a real-time view of how that plan stacks up against the Affordable Care Act.
Scott has a question.
Sure.
Is there a way outside of asking your congressperson to change the ACA rather than repeal it would fix issues related to insurance and coverage?
Well, they're the ones who have the pen, so to speak. They're elected and they're the only ones who can actually vote to change things. But I think what you're getting at is how can you impact it? There are a couple of ways. One that's really effective right now is the town halls. If anybody's having a town hall in your area, even if it's a Democrat who already supports the Affordable Care Act, you still want to go and give your input and help them because there will be a need to make some changes to it at some time. So being engaged and going to the town halls is really important. And meeting with staff is also very important. And of course, all of the legislators are elected, so they pay close attention to what's happening in the press. So I think the number one way that you can impact change in whatever way you're looking for is to work with your local newspapers, social media, explain the value of what we do. I mean, it seems very basic, but that's the type of message that legislators and the public need to hear. So I think that's the number one way you could help outside of visiting your legislator, your congressman or senator, would be to work with your media and social media. There are a couple of people in Congress that like the dismantling of the Affordable Care Act. I'm not saying you should go with torches and pitchforks, but if you happen to live in Congressman McClintock's area, which he is Fresno, I don't know if he has Modesto or not, but Fresno basically east towards the mountains there, McClintock has indicated a willingness to vote for the plan that they put forward. You also want to check in with Darrell Isa's office if you're down in Southern California. Darrell Issa has indicated his support of it, and he also is attempting to do some federal legislation in the area of sober living homes that is very negative to our system. So if you're a Darrell Issa constituent, you want to go to any town halls he has. I would, obviously all of us are professionals, but being respectful and speaking logically is better than yelling at anyone. So I know sometimes people can get pretty heated about politics, but you really get heard more if you can offer information and lead Congress to decisions that are good for us rather than threatening or yelling or being upset with them. We have it pretty good in California, though, as far as support for the Affordable Care Act, or most of the Congress people are Democrats who support, or moderate Republicans who would have a hard time with some of the more conservative approaches to change. Any others, Larry? I'm not seeing them for some reason. Oh, I guess I am.
There's in the question mark thing is where the questions are, but
Okay.
there's no new ones.
All right. So how does everybody like this format? It's kind of I think a more easy way to get some continuing education, and a way that we can talk and give you information kind of in a real-time situation. So we're excited about that. If you have a chance, on the CCAR website, we do have 2 bills that have been introduced and are moving through the legislative system. So I'll just take a little time, since there are no more questions, to encourage you to go and support those. So we have Senate Bill 636, which is by Senator Bradford, and that would abolish the evil practice of patient brokering here in California. Some of the stories I've heard lately, one woman was picked up completely intoxicated at a casino in Temecula and driven to an unlicensed treatment program for the mere charge of $20,000, or as we like to call the most expensive Uber ride in history, labeled as an intervention and billed to her insurance. So the bill by Senator Bradford would take the financial incentive out of referring clients to any treatment. So that's a very positive thing that CCAP has worked to get introduced, and that is moving through. We could still use support letters. And at ccar.info, where it says support CCAR, it shows you how to write a letter, where to send it. It's all pretty easy. And then our second bill is Assembly Bill 285, and that's from Assemblywoman Melendez. And that is a bill to allow voluntary certification of sober living. So it would give people who are doing sober living an ability to be recognized for the quality program that they run, and it would give them first preference in referrals from most referral systems in California, including criminal justice, from programs to sober living. So there's some definite advantages in the new law that for sober living that's quality and wants to come forward and become certified. So that's Assembly Bill 285 that passed unanimously a couple of weeks ago out of its first policy committee, and it's sitting in appropriations waiting to be voted on there. So if you can lend support for either of those bills, if you can come to the Capitol when we give notice of hearings and come to the mic and say you support it, that would be great. But we're really moving forward.
We have a new question from
Sure.
David. Why is there always a percentage factor of payment rather than just paying a standard billed amount? And why is Blue Cross paying less than any other state?
So are you talking about payment for people who are purchasing insurance, or I'm sorry, say the question again.
Why is there always a percentage factor of payment rather than just paying a standard billed amount? And why is Blue Cross paying less than any other state?
Right. The percentage amount is a contract negotiation issue, and they do that with all providers. They're not just picking on us. Although I'm well aware of the Blue Shield situation right now, and I can let you know that we met with the insurance commissioner twice already this year, so we're well aware of what's happening with Blue Shield right now. We put forward in the Senate Bill 636 an insurance task force that would have looked at those types of practices and how they create barriers to care. We also asked that the task force look at automatic step downs, where you get into treatment for 2 weeks and they say, oh, you're better, so now we're going to step you out of residential and change your program. Also looking at fail first policies, where you really need inpatient, but we're going to send you to outpatient and see you fail at outpatient first before we allow you to have inpatient. So CCAP is well aware of what's happening out there on the ground with insurance, and we are working hard to change that. We have another meeting set up with the Department of Insurance, with the Insurance Commissioner's Office themselves. I believe it's in a week and a half from now. So David, I can only tell you that we're aware of what's happening, and CCAP is working toward change and really trying to get an insurance task force to not only look at the underpayment, but also the rejection of claims. Sometimes they're being approved and then rejected afterwards, which is completely illegal, but it's still happening. So if you want to email us, David, about whatever issues you're having with the Blues, or whichever particular Blue you're speaking to, please do so. We are collecting, I don't want to say evidence, but examples of what's happening out there, and you're not the only one. So Is that it? All right. Thank you. We've reached our hour. Sorry for the bit of a slow start due to our technology problems here today. So we'll get better at this. And I hope you all tune into the next webinar if you have time and interest. Thank you.